Hey, Dr. Shakib here from Irvine Spine and Wellness Center. I've decided to do a video on neck nerve impingement, so stay tuned. Alright, thanks for watching. A lot of times people come into my office and they talk about nerve pressure or nerve impingement in their neck, and I just wanted to clarify some of the things that you need to know about. For one, it's not as easy as you think to pinch a nerve. There's more of an irritation of a nerve, but I wanted to go over some of the basic anatomy so you better understand it and see where you can go wrong throughout your day that can actually aggravate the very nerves that come from your neck. So Maddie, remember what we talked about? So I want you to, can you see this? Let me just show it on myself. Forget about Maddie. So I'm gonna over exaggerate this, but you can see how over here, I've got this fossa, this triangle here. So the nerves from your neck come from your neck, and they go through this fossa, and then they go to your armpit and down your arm. So anywhere from the neck to the fossa, to the armpit, down the arm, you can have irritation, you can have pressure on the nerve. So don't think that nerve impingement necessarily means like the nerve is being pressured on and it's being cut off necessarily. And irritation is bad enough to cause symptoms. So some of the things that actually aggravate it are the rolled forward shoulder, the rolled forward neck, and basically you sitting behind your computer like that. A lot of times what happens is you're using your arm rest at your chair, it pushes your elbow up, and it actually irritates these muscles here because they're just swollen and they're in a contracted state, and that's when you end up having issues as the nerve pierces through here to go to your armpit. So in our office, of course, we need to evaluate and see where the irritation may be, and we go about with some of the postural changes, with some of the exercises that have to do with the extensor muscles in the back of your upper back. So strengthening that is important, but if the brain needs to send message down here, and because of lack of activity of this, it starts shrinking, which is what happens, we need to activate that part of the brain that says upright against gravity. So in our office, we not only do work on the extensor muscles back here, we work on exercises that give the command to be upright against gravity. We work on doing ART, which I've done many videos on different muscles that are engaged, like your supraspinatus, infraspinatus, your pec minor. This is the pectoralis muscle, which needs to be worked on so it lets go, and then these muscles need to be pulling the shoulder back, and of course strengthening the back of the neck muscles so it can glide the head back. We go with the adjustment of the cervical spine and adjustment of the shoulder and the AC joint as well. Anyway, that's that. I just wanted to go over that very basic anatomy and understanding. If you like what you saw, please subscribe to my YouTube channel. I do have a Facebook page under the name Irvine Spine and Wellness Center. Same is true with the YouTube channel. So like and subscribe to that or follow that. And remember, you're the designer and the director of your own life, so design and direct it the way you wish to live it. Take care.